Hello, everybody, and welcome to another episode of Exploring Healthcare Professions. And this week, we're going to be discussing, talking about a career in endoscopy. And so today we have with us Stacy Hutchinson, who is a registered nurse with an MBA and a board certification in gastroenterology nursing. She is also the Director of Endoscopy at East Georgia Regional Medical Center. And prior to this, she was the Manager of Endoscopy at Methodist Hospital. So welcome, Stacy. How are you doing today?
I'm doing great. I'm happy to be here.
We're glad to have you.
Thank you.
I think the obvious question is, can you explain to us what endoscopy is and kind of like what its main purposes are and benefits?
Okay, so I'm a registered nurse and my specialty is gastroenterology. That's the stomach and the intestines. And my area of gastroenterology is in the endoscopy department. And that is a department in the hospital. And that's the place where we do the procedures, where we actually go and look at the intestines. So that's where we go in with our cameras. And do colonoscopies, upper endoscopies, and even we in Peoria, we actually even do pediatric GI. So there may actually be some kids on here that have actually had an upper GI procedure. So we're kind of like surgery, but we don't cut anybody open. So that's the nice part. And makes it a little bit more laid back, but still very technical area. As far as, why I got into this, it's, again, at the heart of it, I'm a nurse, and I got into that because of the same reasons a lot of people go into nursing. You want to help people and make an impact. I also kind of have a little bit of an engineer's brain. I like to know how things work, and the human body is frankly probably the most exquisite piece of engineering there is. And as a GI nurse, we get to go in there every day and check it out and help people out. So
That sounds really great. And so I guess with this field, is endoscopy, do you use cameras? Do you use, what are the utensils that you use for this?
So we use scopes, and a scope really is just a camera. It's just a long tubular camera. On a camera, you have a light source, and there's a flash, and there's lenses and all of that. There's the computer components of it. Our computer components are pretty large. A tower that holds, we have boxes that are, about this big. One of them is a light source. One's the processor, and then the scope itself will plug into those things, and it has a handle that allows us to control and navigate. So in a lot of ways, it's kind of like a video game for a kid, but a scope is a really large controller, and it's really that camera. But we have a handle piece that sort of guides us, helps us make turns and work our way through the colon. The other interesting thing about a scope is it's got all these working channels that years ago when endoscopy first started, we could just go into the colon, and all we could do was look and find out what was going on with people. We're at the stage now where there's all these things that we can do through a scope that is really technical and fascinating all at the same time. So we can go in and years ago, actually, even years ago, they just had eyepieces. So somebody would actually even be looking into an eyepiece like a telescope. And now it's up on video camera, and we have these really great pictures from inside the colon, and we can find polyps and cancers, and we can remove them now in minimally invasive ways. Whereas years ago, we could just go, oh, well, there's cancer in there, there's a mass, now you need to go to surgery. And now we're able to do things about them. So.
Well, that sounds wonderful. And going off of that, I just mean that sounds so, I know nurses definitely get undercredited because you do so much that I think that people don't realize. But I also want to know, how did you specifically get into endoscopy? Because it sounds so, I don't know how to say it, it just sounds so fascinating. but definitely something that you don't think about. Like you
Mhm.
might hear that, oh, I got to get an endoscopy, but it's like with the way you're describing it, it sounds so much more than that. So how did you get into endoscopy?
So I wouldn't say it was by accident, but it definitely wasn't, there wasn't a plan. I honestly didn't know a whole lot about all the areas of nursing when I actually graduated nursing school. Um, I believe though that if people just sort of let the things that excite them and interest them and their life experiences sort of lead the way, you will end up in some really interesting places. But for me, you'll go if someone goes to nursing school, they will get exposed to a lot of the general areas of nursing. And from that, you'll get an idea of what your interests are. And so when I was in nursing school, I was more interested in surgery. I was interested in the procedural areas. Um, and I was also interested in the outpatient world, also because that was a schedule that was really more conducive to being a working mother, more Monday through Friday, that sort of thing. But the outpatient world is really more like doctor's offices, and that really wasn't very exciting to me. And just through trying to figure out where my place was in led me down that road. And endoscopy was a perfect fit because it's actually an outpatient department in the hospital. People don't get admitted. They come in, they have their procedures because they need to be in that acute setting to have the procedure done, but then they get to go home. So it's really just sort of that perfect mix of what where my interests were. So a little bit of procedure on a little bit of outpatient. So when I graduated nursing school, I didn't have any clue what endoscopy was. It was just sort of one of those things that happened. So
And I think that that's what this series is all about because I think a lot of the time when somebody says, I want to go into the health professions, they think nursing or doctors. However, so you went down the path of nursing and then you kind of realize that there's a lot more specialties that aren't talked about,
yeah,
like endoscopy.
absolutely, absolutely. And this is a really great one. It's just I'm very passionate about what we do, and I just think it's the best of both worlds. And there's a really good work-life balance. It's a really good culture. Surgery is a little bit more intense, and endoscopy and the outpatient procedural areas have a tendency to be a bit more laid back, and it was just a good fit for me.
Well, wonderful. And so I think the big question for all high schoolers is if they decide to go down this path, I guess, what is the financial expense? Is it manageable? And how long would it something like this take to obtain?
So when you say the financial expense, do you mean like the cost of getting the education
So kind of,
or just the general financial outlook?
yeah, the general financial outlook, kind of weighing the expenses of the education with the expenses that I mean the income that you get afterwards and things like
Sure,
that.
sure. So everyone should minimally expect 4 years of education. Um, Now, there is an associate's degree in Peoria that you can obtain in nursing, which is a 2 year degree, but most of the employers are actually requiring a 4 year degree at this point. Now, there is a benefit to that, and it's a financial one because there is a nursing shortage. And so as far as the outlook and being able to find a job and making a good income, um, that's not a problem at all right now. I mean, everybody needs nurses so bad, and there's a lot of financial incentive right now, and there's also a financial incentive in terms of the schooling piece too. So if you did happen to go to that 2 year program and then get employed at the hospital, the incentivization at the hospital could help pay for that BSN that you want to obtain. So that's not a bad road to go down. But 4 years basically, and you will make a good living. There is obviously a spectrum. Nurses who work in doctors' offices do have a tendency to make less money than nurses who work in the hospital. And then right now, with the pandemic and all of the things that are going on with a nursing shortage, travel nurses, they're making a fortune right now. There's just such a huge need for nurses, and everybody's just sort of trying to get nurses, and so it's it's good.
Well, I think that's definitely good to hear from the students, or for the students, I'm sure, because they have all these pressures they're probably going through. But just knowing that, yes, like going down this path, it would be good financial decision, and you can get an associate's, you can get a bachelor's or a master's, and with how much nurses are needed, especially during this pandemic, I think is probably.
Yeah, nurses are needed in so many places, and even I don't even, have the grasp of all of them, and it continues to evolve also. Now that everything is electronic, the last 15, 20 years, the advent of the nurse informaticist is a new role, which I know we're not talking about that, but I'm even sort of blown away just in 20 years how there's so many things that I could do with my nursing degree. And that's one that's really needed right now. People who really understand how to take care of patients and then make it happen in a computer, and get the computer to work with you in a way that allows you to document and show the picture of what's happening with a patient. So, yeah.
So leading into your obtaining your degree and into your career, what was the classroom experience like, and how was the curriculum?
So a lot has changed in the last 21 years since I went to nursing school. And I actually graduated from Methodist with a diploma degree, which was considerably a more hands-on degree. By the time I graduated, I was in the hospital 3 days a week taking care of a load of patients. And that's really non-existent, at this point, not at least for the amount of time and experience. Associate's degrees do have a tendency to have a little bit more of the hands-on stuff, and then bachelor's degrees the least. If you're someone who really needs to have hands-on experience to learn, I would really encourage maybe somebody to go that associate's route, because you are going to be more in the classroom with that BSN, and then less clinical experience. And then, the bad thing about the clinical experience is, and I shouldn't say bad thing, but if this is your clinical day and nothing really interesting happens, or if there isn't an IV that needs to be started, or a catheter that needs to be put in, or a person who needs to be set up on a pain pump, you're just not going to get those experiences. So, what I would encourage young kids to do, and this kind of goes along with what I was saying about how nursing school will help you see what, your interests are. Go get a job as a CNA, go work in a nursing home, go work in a doctor's office. The hospital is probably the best place, because you could be a CNA and you could float to all these different floors, and you could find that niche, that place that's interesting to you. You can go up on a respiratory floor and see patients on vents and just be like, oh my gosh, this is, I don't like sputum. I don't want to do this, But then, you can go into the GI department and hear the same thing from somebody else who's like, no, don't want anything to do with the bowels. But, that's just it. If you go out and you find the experiences, you will find your place. You'll find what drives you, what interests you, because you may just not know before that.
And is it a possibility for, if maybe somebody's not sure like how they learn best, or they just want to experiment, that they could do the associates to get the hands-on and then continue with the bachelor's?
Well, like I said earlier, most of the employers in Peoria, hospital-wise especially, require a bachelor's degree. So I think that is a good route to go, because you can work and get more experience while you're in that classroom setting. And I realize it's hard to go to school and work at the same time, so it may not be for everybody. But, I will say that one thing about today's technology, it does allow us to manage school a little bit easier, because you can do it from home and you can do it from online. So,
And so I think you kind of highlighted this a little bit just now, but more specifically, were there any good internships, opportunities, or experiences that helped guide you into either whether it be nursing or specifically endoscopy?
So, as I said earlier, I really didn't know the extent of nursing when I went into nursing school. And I give the advice that people should work as a nurse aide because I didn't do that, because I didn't have that experience. And so for me, I did have to find that niche a little bit after nursing school. So that experience for me wasn't until after I graduated and I started working at Illinois Eye Center, and I was their surgical coordinator. And it's interesting how colonoscopies and cataracts really have a lot in common. They're outpatient elective procedures, healthy patients every 30 minutes. You have to really have a good, clean, solid operational sense and a good coordination to make those happen. And so that's really where I cut my teeth, sort of on the operational piece. That was sort of the building block that makes me a really good endoscopy manager, because there's a lot of similarities there.
And you also mentioned that you worked at Methodist for many years. You also went to Methodist college. If it was still called Methodist College, right?
It was Methodist School of Nursing, actually.
Methodist
So
School
it
of
wasn't
Nursing.
even a college yet because it was a
Okay.
diploma program. Yeah.
So Methodist School of Nursing.
Yeah.
So you've been in the area for a little bit. What made you decide to make the move to your current position? Because you were manager of endoscopy at Methodist.
Yeah.
So yeah, what made you decide to make that move to East Georgia?
So it was really a series of events. It wasn't really a single thing. So, I worked as a GI nurse at Methodist as a frontline nurse for a really long time. Opportunities came my way. I didn't turn them down. I took them, and I just continued to sort of build a toolbox of sorts of skills and experiences. And some would say items for my resume, but it's just life experiences that I took on. And of course, simultaneously, as we've known for decades that healthcare is not sustainable. Healthcare reform has brought a lot of changes, and hospitals and systems are looking for ways to save money and to consolidate. And my position as a leader at Methodist was actually cut as part of that consolidation. So they took the endoscopy department down into surgery and put it under that. So I was offered a position, but it wasn't something that really struck my passion. And the interesting thing is, I knew this was coming for quite some time, and in that period of time is the time that I spent preparing myself, or just building up that toolbox, so to say. One of the analogies that I use with my staff is the rain. You're not going to stop the rain from coming. The thing that you can do is get yourself a raincoat and some galoshes and an umbrella. So, change is going to come one way or another. And instead of, being angry or not being prepared, do what you can do to make sure that when it comes, you're prepared. So when the time came, at that point, I had my BSN. I had lots of years of nursing experience. I had my GI certification and I had my MBA. And so at that point, I had options. If I hadn't done all those things, I probably would have felt like I'd had to have taken that job that really didn't feel like a good fit to me. So, so with all that said, that's kind of where it was at. And I actually have family down here. And I also became an empty nester. And I just didn't, I'm like, well, I guess there's nothing really keeping me here in central Illinois at this point. And I wanted to grow more in my career and also get closer to family. So that's how I ended up down here.
I really think that that rain metaphor is really good actually for other parts of your life even. I really like that.
Absolutely. Absolutely. There's so much change in healthcare, and it gets to the point where we're all just, especially and COVID is sort of the pinnacle of all of that. Every day it was changing, but That's the way healthcare is anyway. And to your point, life, and you can be angry and you can buck that, or you can just go with it and be prepared for it. And don't limit yourself by saying no to things. Let all those experiences come, because again, a lot of times they're building blocks that will get you to the next place.
Yeah, it obviously worked out for you. You went from a manager at Methodist to a director, so that's awesome.
Thank you.
So, um, speaking of you being the director of endoscopy at East Georgia Regional Medical Center, what is a typical day like for you?
So, a typical day for me is pretty busy. Since I've been down here, because of um, all of the things that are sort of in that toolbox and all the experiences I've had, they have also given me a wound center, and they have also given me an outpatient ambulatory unit that does outpatient infusion. So I have quite a bit on my plate. I have three small specialty teams, and my role as a director and even a role as a manager is less about taking care of patients, and it's more about taking care of the people who take care of patients. So that is really what I see my role as. I think that employees who are in a good environment, who are in a good team structure, who love what they do, who are supported and have the knowledge and the tools to do their job, are going to do better at taking care of patients. And so if you love what you do, then you're going to do it well. And so it's my job to make sure that my people love what they do. Most of what I do is really administrative at this point, hiring and setting up training and payroll and meetings and that sort of stuff. I do also run an endoscopy interdisciplinary, which allows all of the separate silos of what we do to come together. So the clinic and the hospital and the physicians and anesthesia and staffing, all of that comes together in this interdisciplinary team that I run. So again, it's really more administrative. Every once in a while, I'll run out there and start an IV or do something, or jump in a case, just because I want to make sure I'm still connected, in that way with the hands-on stuff, and because it's fun too. But for the most part, it's office work.
And speaking of that, what do you think, uh, since this is kind of a little different than what you initially started off in your career doing, what about this new job, or I don't know if it's new, but what about this current job sparks your inspiration the most, or sparks you wanting to wake up every day, like with your coworkers, with your community, or with the
Yeah.
area?
So interestingly, one of the things about me is I'm a little bit drawn to chaos. I'm a fixer, or I wouldn't say drawn. Well, maybe I am drawn to it. Um, I thrive in it because I want to fix it, because I want to clean it up and I want to make it better. The thing that I love about down here is the perspective that it's given me and the opportunity that it has given me. Um, you know, the South is known to be kind of laid back, and they don't really like change. Those are um, things that typically, people say about the South, and to some degree, that's true. And there are a lot of opportunities here, but interestingly too, it's rural as well. And so a lot of the things that we see on the news about healthcare across the country, you see them on the news, but from being down here, I've seen them firsthand and I've lived them, and they have barriers down here that we may have in Central Illinois, but we don't have at the extent that they have down here. And so, with that sort of maybe not being as progressive or being where they should be, and then having all these barriers, that in itself was just a really great perspective. But then, as for me, there's this opportunity. I feel empowered down here to come in and say, hey, I know how we can fix that. And I'm grateful for the other parts of my career, and I'm grateful to Methodist and all of that leadership training and all of those experiences, because I've brought that here, and it allows me to help this community and help my team and the people here to get where they need to be. So
It sounds like you really enjoy your job.
I do. I love it very much.
And so then also coming back to that student aspect, to all the students that'll be watching this, why do you think that this, well, let's break it up. So why do you think nursing is a good field for students to get into? And why do you think endoscopy or other specializations are good things to branch off from nursing?
Okay, so first of all, as we talked about before, there's so many things you can do with a nursing degree, so many things. And it's just a field where a single degree could take you on so many different interesting journeys. So there's that. Also, there is a huge need for nurses right now. And, it's just, we have all of these baby boomers, and I think about it for myself too. If we don't have more nurses, who's going to take care of me, when I get to that point. So there's that. As far as GI goes, the thing that's great about GI is, as in the grand scheme of healthcare, GI is still pretty green. Our technology continues to expand and grow, and just even in the 15 years that I've been doing GI, the things that we can do through a scope are just growing like crazy. And surgery and endoscopy are starting to merge. And so again, we're doing more minimally invasive surgeries. And the GI doctors are the ones who are most skilled at running the scopes, but it's the surgeons who are most skilled at doing complex interventions. So again, it's these two worlds coming together. I have surgeons who will constantly call down to endo and say, send me an endo nurse, because not because the surgical tech is doing anything wrong or they're not good, but because they want the skill of the person who understands that technology and the things that we can do through a scope. So there's just so much more, and it's just growing continually. So it's just a really interesting field. It's just fascinating to me.
I'm sure it'll continue to grow, and
It
it'll
will.
continue to baffle, I think, people like me who have no idea what it is or how it's done, because
Yep.
as we get more technologically advanced, and then of course serving making those things available to more people.
Yeah. A lot of the things that we do were available to people. They're just available in a different way now that makes them less impactful on the patient's life. So, at one time you could, when scopes were new and first invented, you could go in and you could find out that there was a flat polyp in there that looked like it could turn into cancer and it needed to come out. So then at that point, the patient has to go to surgery, get cut open, have that removed, and the recovery from that is long and extensive, and it's painful. And now we don't make any incisions. We go in with our scope, and we can go down with a really long needle. We can inject underneath that flat polyp, puff it up a little bit. We pull out a snare that lassos sort of around that flat polyp, and we cut it off, and then we go down with another tool that allows us to cauterize and close that hole up. So we haven't cut into anyone, and they can go back to work on Monday. So we're not doing necessarily anything different all the time. We're just doing it in a way that is less impactful on the patient and gets them back to their life. So
I definitely think that's game changing for some people that maybe they have to work and they don't have that time to recover for their family.
yeah, absolutely. Yeah.
So we definitely all appreciate that. And then, of course, finally, do you have any final words of advice or encouragement for prospective students and professionals in the fields?
So I do have a list that I created, and I'll go down that. I've got about 5 bullet points.
Okay.
So first of all, I want to say that degrees are required, but experiences are what are going to grow you and lead you to a fully rewarding career in life. So point number 2, try to take all those experiences that you can get. Don't run away from them, no matter how scary they are. Sometimes even the bad experiences in life are going to be the ones that teach you something that you might need in the future. You know, the universe does have a way sometimes of throwing you those building blocks to get you to that next place. Going back to my rain analogy, change, you know, it's going to come whether you like it or not. So make sure you prepare yourself with all the tools when it comes. Don't limit yourself in any way. You know, don't say, oh, I'm not going to go ahead and get this extra degree. You know, if I hadn't gone and got my MBA, I probably wouldn't be looked at for a lot of jobs, because, you know, healthcare providers are looking for people who have a little bit of business sense as we're trying to make healthcare sustainable. But I remember having those conversations with people. They're like, oh, I don't need an MBA. I don't think it'll help me in any way, you know. But don't put yourself in a position where you're going to limit yourself, because, you know, something that you take on that you may not want to do might actually be the requirement that you need to get your dream job, you know. Another thing is honest self-reflection. That's something that'll help guide you, but you also need to know that sometimes the things that we think or believe about ourselves may actually limit us. So don't say, oh, I can't do that, or I don't like that, or I won't enjoy that, or that's not for me. You really need to give it a thorough go before you decide that. When I was young, I used to say, I just want to be in charge of things. I don't want to be in charge of people. People are too complicated. Things are easy. And now here I am. I love leadership, and I love mentoring people, and I love the role that I'm in. And I never thought I'd be here. But for years I did say that, oh, I don't want anything to do with that. And then the last thing I would say is, whatever you do, just be passionate about it. You know, if you're not passionate about it, go find something else to do that will drive you. You got one life. Very few of us in life are independently wealthy. You got to go to work every day. You might as well do it doing something that just makes you smile every day, drives you every day, and makes you passionate.
I definitely couldn't agree more. Those are great words of advice, and I just want to say thank you for making some time out of your day to talk to me and then talk to our students that are listening. And yeah, thank you.
You're very welcome.
All right, and everybody, like I said, this is going to be aired on Wednesday. You'll be watching it on Wednesday, hopefully, and we're going to continue on our series of exploring the healthcare professions, and our next one is going to be speech pathology. So make sure to check that out next week when we talk with Danila McCasey. Thanks. Bye.